Welcome to the Stress Free Dentist Podcast. I'm your host, Dr. Eric Block. As always, I want to inspire, entertain, and educate you on the best tools and technologies out there. My goal is to help make your practice and career more profitable, efficient, and most importantly, more enjoyable. And check out all of my nonfiction and children's books on Amazon, and check out the stressfreedentist.com for any upcoming events. And if you're feeling you're a dental professional that's burnt out, or you just feel stuck or want to get to that next level, visit the International Academy of Dental Life Coaches, or www.iadlc.com, and we'll get you matched up with a life coach that understands dentistry. I also wanted to thank our amazing sponsor, Equa Marketing. They have helped me and my practice over the years to improve with SEO and website performance. And to find out how you can make your practice dominate in your area, go to www.equa.com/MSMSFD to book your complimentary meeting. Again, that's www.ekwa.com/MSMSFD. Hey everyone, welcome back to another episode. And today we are joined by Dr. Danny Snyder. How you doing today?
Doing really well. How about yourself?
I'm doing well. I really want to hear about your story in dentistry, but also as being an entrepreneur for Slate Flosser. Danny's the co-founder of Slate Flosser, which is an awesome product that I have. But Danny, let's first find out about your journey into dentistry. How did you decide to become a dentist?
So my 8-year-old self would definitely be disgusted with my career choice because I had more than a few traumatic experiences as a kid. But right around the time that I was going into college, I originally thought that I wanted to go into medicine. And so my very first semester, I took an evening seminar class. I think it was just 1 or 2 nights a week, and they'd bring in doctors, insurance people, administrators at different medical schools to kind of just answer our questions, and very quickly saw that medicine wasn't what I thought it was. And so the next semester, a buddy of mine was like, hey, let's do the dental seminar. So it was kind of the same thing, but the next semester. And just quickly saw a number of things that attracted me. One is just, in medicine, most doctors aren't their own boss. And so I saw that as an attractive thing. I also love working with my hands. I love art, woodworking, and different things like that, and saw how dentistry could kind of incorporate that. And then just talked to a lot of dentists through that program and that class, and just saw that it had a good family life balance, and knew that I wanted to have a bigger family, and that would kind of facilitate that. So from then on, that was kind of the plan.
And now, where did you go to dental school, and where do you live and practice now?
Yeah, so I went to the University of Louisville in Kentucky and loved every minute of it. Had a lot of fun experiences. One of which they actually recruit dental and medical students to work the betting windows at the Kentucky Derby. And so did that 1 year, and that was super fun to just kind of experience it from that side of things. So and then after a 2-year stint in Houston, my wife and I have settled in Spokane, Washington. So I'm from Utah. She's from Canada. Kind of splits the difference here.
And now tell me about your life after dental school. Did you associate for a while? Did you start up your own practice? What happened there?
Yeah, so I actually, right out of dental school in Houston, I worked in a practice that was about 20 minutes west of town, kind of in a rural city. And it was an amazing practice. We had 16 chairs, 5 doctors, 3 of us were there each day. I lived in Argentina for a little while, so I'm fluent in Spanish. So it was nice to be able to utilize that with all the Hispanic patients that worked in the farming community where we were. Um, and just a really great boss down there. So I got my speed up really quick and had a good experience. But as soon as my wife and I decided that we wanted to buy our own practice, we were like, okay, where do we want to live forever? And Spokane was already on our radar from some friends and family that lived here, and put out some feelers to some dentists here in town, and found a practice that was up for sale and made the jump.
And now, so you ended up buying a practice, or I'm sorry, did you say was it a scratch startup, or did you take over a practice?
No, it was I think he was 71, the retiring dentist, Dr. James Hoppy, a really, really good guy. Um, and my wife, who's a graphic designer, when we wanted to come up here, she actually made this like 12 by 12 flyer that had a bunch of kind of photos of us and our family, had things like about us, what I was looking for in a practice. And we actually sent that out to every dental office in Spokane, and we got a pretty big response. I think it was 160 things that we sent out. And we heard from about 25 different practices, people looking for associates, people looking to sell, people looking for a partner. So then I made a separate trip up here to kind of meet with 4 or 5 of them that looked really attractive. And from there was able to pick the office that I was at. And it was just a really good fit for me and the type of practice that I wanted and the way I wanted to practice. And so, yeah, it's pretty awesome.
That is such a smart idea to do that, to send out flyers of you and your family and kind of show these offices who you are as a person, as a family. Such a great idea.
Yeah, and that's actually I kind of stole half the idea from a kid. We were doing our oral surgery rotation my junior year of dental school, and there was a fourth year who was in there, and he had done the same thing, but just sent like a written letter. And he had come from a pretty small town. I think there was only like maybe 10 or 12 practices in the area that he wanted to go back to. And so he's like, I sent this letter to all 12 of them. And so then when it came time for us, I was like, well, let's take it one step further. And I think that's one thing that a lot of young dentists can really profit from, is the idea of just like approaching all these problems from, you know, a position of creativity, and just being able to show people a little bit kind of who you are, your personality. And yeah, it was kind of nice because in the end I had my pick of a few different practices rather than going through a broker and all that type of stuff.
That's what we try to do on social media, right? Is we try to show these patients or potential new patients who we are, and if we're someone that they can get to know, like, and trust, and call us to become a new patient. So that's just such a great idea to show your personality, of who you are. And we do a similar thing with our social media. But um, so after that, you bought a practice, and things weren't all peaches and cream, right?
You know what? For a while, they actually were. It was about as smooth a transition as I think you could have. And sometimes I hear people, they come on, the retiring dentist stays on for a little while, but then there's kind of this back and forth with the staff of like, okay, who's in charge here? So we decided to go the route of, he was done on Friday and I was there on Monday, and he was such a phenomenal dentist and just such a good person that for me personally, most of the patients immediately bought in. They're like, we know that he would pick someone who would treat us well, and then also just inherited a good staff, and we were able to keep most of that staff on for quite some time. But I would say COVID was really what kind of threw the wrench in things. That's when things started to not be quite so fun as a practice owner for me.
What happened? What happened during and after COVID that changed things?
I just think we weren't an extremely high producing office, when you look at the averages. We were just kind of a bread and butter practice and just took good care of people, gave enough time for all procedures, so we weren't packing people in. And so when COVID came around and, we were off for 2 months, came back in, um, here in Washington, we already had an extreme shortage of trained dental staff. And so hygienists, assistants, different things like that. But then afterwards, and I think this is common to a lot of different areas, a lot of staff just didn't want to come back. Now, my staff was all willing to come back, but there were other offices, and especially the community clinics here in Spokane, a lot of the staff were like, we're not going back to put ourselves into a situation where we might get sick. And so a lot of these community clinics were offering hygienists like $65 an hour, where I was paying mine more close to 45, 46. And so and rightly so. I don't blame them, but a lot of my staff asked for pretty sizable raises, and then you had the increased costs of all the PPE, masks, gowns, all that, gloves, stuff like that. And so just, my personal earning potential went down pretty significantly because I did give my staff these raises so that we could keep the team together and keep taking care of our patients. And then that just kind of slowly snowballed over time, and just there were some additional stresses that came along, and it just got to be difficult.
And I've been there, I've been to the point where I wanted to leave dentistry and was really unhappy. Personally, I went through coaching and therapy. What was it for you that kind of turned things around? Because we were chatting before we hit record, and it seems like you're back to really enjoying dentistry. What changed there?
Yeah. So, through this process, a dental group actually bought the building that I was in and offered to buy my practice, and it all looked good on paper. And so we ended up going through with that. And then I was working back for them for a short time, and it was pretty mutual. After about 6 weeks or so, we kind of came to each other and like, this isn't what we thought it was going to be. It doesn't feel right. So I ended up leaving and becoming an associate for a friend of mine. But through that process, I was able to, like you said, kind of do some therapy and different things like that. And the thing that really moved the needle for me big time, and think that a lot of dentists who may be struggling should at least look at the possibility of, is something called EMDR therapy. And it's just something that, in a nutshell, it's a way to activate both sides of your brain and kind of work through traumatic experiences in your life that your younger brain maybe didn't have the right tools to make sense of. And so for me, like I mentioned earlier, it was those traumatic experiences as a kid that we actually worked through. And it was interesting because this process, I remember going to the first few sessions with this therapist that had been recommended to me, and I she never said anything therapeutic. She just kind of talked me through these experiences. And I was like, what am I paying for here? So, but then after about 5 or 6 sessions, I remember I had this patient that was just, the epitome of the type of patient you dread to have in your practice. She was complaining about the cost. She flinched every time I touched her cheeks. I gave her anesthetic, and she was just terrible from every aspect of it. And I went back to my office after we had, checked her out, and I was sitting there, and normally with a patient like that, like my heart rate starts going crazy, kind of cold sweats, just kind of like these ruminating thoughts of like, why am I doing this? I don't enjoy this. And and nothing. It was like I didn't feel any of those symptoms that I would feel almost every day from the time I was done with dental school. And then the next day, almost the exact same thing. So then the next time I went in to see this therapist again, I was like, what did you do to me? Like, what? Why am I like? And so that's been a year and a half now. And I still see, that same therapist, but now for just kind of traditional talk therapy. And I see her every 2 or 3 weeks to just kind of check in on things. Um, but it has been a very dramatic shift to be able to really enjoy going to work every day and doing what I'm doing. And now, I think for a long time, like I said, I've always done kind of the bread and butter dentistry, but didn't allow myself to go towards like endo, implants, cosmetic, things like that, just because it meant more possibilities for anxiety and more interface with patients that may not be pleasant or whatever. And now it's like, no, I can do that. And so it's been fun. I've found a newfound love for dentistry as a whole.
I had a very similar experience with therapy, and we also mixed in some prescribed medications. And like you mentioned, the word nothing, all of a sudden, I used to just focus on a lot of negative things and the one or two bad things that would happen during the day. Like, for example, that patient that you had, I'd be thinking about it. I'd get home, I'd be thinking about it. I'd be thinking about it at night. And and this didn't happen overnight, but through sessions of therapy and soul searching and like I said, some prescribed medications, all of a sudden, there was an absence of that negativity.
Mhm.
I don't have an absence of feeling. I still have emotions, but I wasn't beating myself up over these negative things. And like I said, it took a while, but and it's just even compounded where I feel like just like you, I'm able to add new procedures, new things that I never would have done before because I was clogged up with fear and negativity and anxiety. But now I'm so much more open and kind of free of those negative thoughts. Do you kind of feel the same way?
100%. And I think that's why um, Allison, the clear aligner coach, put you and I in touch with each other after I met her at an event in New Orleans in March. But yeah, I think we're extremely similar in that way. The prescribed medication thing was a frustrating thing for me because a lot of the kind of new in vogue drugs didn't work for me. And so that process is very, it's such an inexact science where it's like, they kind of ramp you up onto a certain medication. If it doesn't work, then they kind of ramp you down, then you can start the next one. But if anybody's, like you said, going through this, I encourage you to keep trying because there are, for me personally, it was a couple of drugs that aren't really prescribed as much anymore, but for me, really moved the needle, like you said. And so that's also been a huge benefit for me personally. But yeah, I totally agree. It's one of those things where I at one point felt so little hope for, enjoying dentistry in any way. And and so I think that if anybody's out there listening and having these same issues, um, look for some resources, start trying some things because you'll be amazed at how dramatic the reversal can be sometimes.
Yeah, I went through a similar frustration with medications, and it was actually me trying to be too scientific with it, and I kept wanting to try new combinations and new dosages, and it was actually the first medication and dosage we started with is the one I ended up going back to. So you have to kind of ramp up, you ramp down, and
Uh,
it's a whole thing. But ultimately found what worked for me. But
yeah.
awesome, man. Thank you for sharing. And I want to get into the fact that you're not just a dentist, but you're an entrepreneur. And tell me all about Slate.
Yeah, so I've always kind of think had an inventor's brain. I've always had little things that kind of clinking around in my mind, and I always draw things out. Sometimes I'll even go as far as starting to make like little prototypes. Like I said, I'm a woodworker, so I got all the tools in my shop, so I'll go out there and tinker sometimes. But anyways, it was the summer of 2019, and the dentist who was my mentor during my undergrad years had put me on to the Reach slash Listerine flosser. You can get them at every drugstore. They're about the length of a toothbrush, non-electric, and just a piece of floss in between, the two floss arms. And I'd used that for about 15 years. And one day I was sitting in my bathroom and I was using this little flosser and I looked down and saw my Sonicare sitting on the countertop. And I was like, I wonder. So I actually picked them both up and held them in my same right hand, but extended the floss head about an inch past the brush head and then turned it on and flossed my mouth. And again, I've used this product for 15 years. So it was an immediate awareness of something different. And the two main things were that with the vibration, it slipped through my really tight contacts a lot easier. And the other was as soon as I was done flossing, my whole mouth just had this tingly clean sensation that it had never really had before. And so my first thought was, this has to exist. And so I went on to the internet and Googled for probably 3 days straight. My brother-in-law is a patent attorney, so I had him help me kind of learn how to look up stuff on the USPTO site. And there were a couple things, a couple discontinued products. Oral-B had a product in the 90s called the Hummingbird. It was a very awkward hold. And it was very short. So I don't really get how they anyways, so it wasn't, it kind of got discontinued, and then that same Reach brand had almost the exact same flosser, but a nice thick handle, and you could still find those on eBay for like $200 or something. I guess some people continue to really want it over time, but also discontinued. So, anyways, so I first started kind of thinking about it, and I was like, you know what, I think this might be something that is worth making. And so I found an old electric toothbrush, kind of cut it apart a little bit, used some triad material to kind of hook one of the floss heads on top of it. And again, just kind of started making crude prototypes. And it kind of got to the point where my wife and I were like, okay, we're either gonna forget about this or we're gonna try it. And so um, it was actually February of 2020 that we sent our life savings and a good chunk of money from a dental school buddy of mine um, who was willing to kind of invest and help make it happen. And we sent our life savings to these engineers. And then about 2 weeks later, the whole world shuts down and COVID hits. And, we didn't have a job for 2 months. And my wife was like, call them back, get our money back. We can't live. And so, but it actually kind of ended up being a little bit of a blessing in disguise, because for those 2 months that the office was shut down, I was able to work on it full time with these engineers and kind of start to get the design right. So, um, yeah, so that's how the process started over time. I kind of operate a little bit under the assumption that the majority of dental patients are only willing to pick up one tool in addition to their toothbrush. I think if we throw 5 or 6 things at them, then it just makes it less likely they're going to do any of it. And so I was like, yes, it needs to be vibrating floss. But on the other side of it, it also um, needs to kind of stimulate the gums. And so for a while, it's like, how can we kind of recreate that C shape that we always tell our patients to do? And I was like, well, we need the floss really tight to be able to get through the contacts. So what could we do that would take the place of that C shape? And so I started, really studying the shape of the embrasure. I would take light body material and just kind of squirt it into my embrasure and then kind of pull it out and study kind of what the shape of it was. And that's where we came up with the gum sweeps. So on either side of our floss head, you have these little triangular shaped kind of pyramidal gum sweeps, and have little ribs and bristles on them, shaped very similarly to the embrasure. So instead of doing the C shape, it's just a simple in, out toward the cheek, out toward the tongue, pop it out, going into the next area. And then the last thing was when I used my old Listerine flosser, I had a really tight contact that it was really hard. So I'd actually slightly bite on it to help it pop it through the contact. And then I was like, that would be really unpleasant if that was vibrating plastic and you kind of bit on it, or even if you pulled it out of a tight contact and it hit your opposing teeth. And so I was like, all right, let's put some rubber on the backside of it. And then I was like, oh, well, if we're going to put rubber back there, let's make it functional. And so that's where we came up with the idea for doing kind of a 3-tiered tongue scraper on the back. So that was kind of the main thing. During the same time, my oldest daughter was getting into braces. So we did end up developing another head for kids in braces, kind of operates similarly to the platypus flosser, where you got nice little skinny plastic tip there. Then we kind of took it one step further. As you go in deeper on the sides of the brush or the floss arm are these little bristles. So at the same time as it's going in and out underneath the braces wire, it's also brushing the sides of the brackets. So that's kind of where things ended up.
I have one, and it is, you feel so good after using it. And we have our patients using electric brushers, electric toothbrushes. We tell them that it does a better job than their manual toothbrush. Same thing with floss. This just feels like it. You get in there so much better, and you feel your teeth and gums feel so good after. So congrats on this invention and getting it out there. That is so great. Now,
Thank you.
what is the future for Slate? Any products in the pipeline?
Yeah, for sure. So one of the things that we've actually had a lot of requests from our early adopter hygienists is like individually wrapped heads so that they can actually use this at the end of the cleaning to floss their patient's teeth. And especially where in a lot of practices that do assisted hygiene, the assistant comes in afterwards and often does the flossing. And so a lot of these hygienists are like, I'd feel a lot better passing that off to my assistant, knowing that they had this in their hands. So yeah, we're going to be coming out with some sleeves kind of similar to the sleeves that go on your curing light or your intraoral camera, and then individually wrapped heads. And that also then becomes a really powerful education tool for the patient, because the patient's like, wait, what did you just use? Why does this feel different? And then you can then get them on the flosser. And so that's one thing that's coming down the pipeline. I am just starting to work with our engineers in Taiwan on version 2 of the head. I found some ways to make the gum sweeps a little bit more effective and more adaptable to different sizes and shapes of embrasures. And then by the time this podcast airs, we will have our version 2 of the flosser out, and it is rechargeable and has multiple power settings. So that'll be a little bit nice for people. We have some people that want a little more power, some people that are like, it's a little too powerful. So we'll have kind of 3 settings to have people be able to pick their poison.
Yeah, and that's a great idea for hygiene to use it on the patients in the office, because you only really need one hand to do it, whereas with traditional floss you need 2 hands, so it's a little bit easier.
Yeah.
Man, great stuff. 2 final questions. How do we
Yeah.
find out more about the Slate Flosser? And final question would be, what advice would you give to the young dental professionals out there?
Awesome. Yeah. So give us a follow on Instagram. It's at Slate Flosser. And we're always putting up, you know, different deals for people. Like we run deals at different times of the year so they can get some discounts to just a lot of good educational material. And then just a way to kind of help people understand all the benefits of flossing that go well beyond your oral health, things like that. So, yeah, as far as my advice for younger dentists, and I've been out about 10 years now, and debt was crazy when I came out. And so I really feel for these younger dentists that come out with an extreme amount of debt, because that sometimes puts a little pressure on you to maybe overextend, do procedures that you're maybe not comfortable with, go a little faster than maybe you're ready for. And so the main thing that I would recommend is to really just take a pause and think about, with all you know as a dentist, what kind of practice would you yourself want to go into? What kind of practice would you want to take your family to? What does that dentist act like? How does he diagnose? How does he communicate? How does he treatment plan? What is the flow of that office with front staff, back to front staff, things like that? And really not so much focus on doing all these things like, I need new patients, I need to do more dentistry, I need to work more, I need to do all these things so that at the end I'll have an end result that I'm happy with, whether it's, more income, more whatever, and really just focus on becoming that dentist that you want to become, the type of dentist that would attract the type of patients that you want to deal with on a daily basis. And it can be a little bit frustrating because that's a little bit more of a long game, right? But I think that for me personally, that has made all the difference in the world. I now work with a set of patients that I get along with. I have incredible staff who supports me, and I support them. And in the end, I get up and I'm excited to go to work rather than what the reality was for 8 years for me.
That's great advice. And also shout out to your wife for being on How I Built This. That listened to that podcast, and I was jogging and was listening to an episode, and she came on talking about Slate Flosser, and I was like, I know her husband. So shout out to her. Great
Yeah.
episode.
Yeah, she did a great job with it. I mean, that's a pretty crazy story too. So back in September, um, I I've listened to How I Built This since 2016 religiously, 2 episodes a week every time. And in September, I sent Guy Raz, the host, 4 flossers, one for him and his wife and his 2 boys. And my mom is a professional calligrapher and has taught us calligraphy. And so I did a pretty fancy address label that I put on the bag that we sent off. And about a week and a half later, he actually called me on the phone, and it was one of the most surreal experiences. Like, some people are like, oh, that's kind of nice, but I was like, for me, that's literally as if Taylor Swift called me on the phone. It was like, oh my gosh. So yep. And then they just started doing this new segment where they're bringing on young entrepreneurs for advice from seasoned entrepreneurs. And so that worked out. That was fun. That was a nice boost for sales too.
That's great. Danny Snyder, such a great episode. Thank you so much for joining us. Thanks again for listening to the Stress Free Dentist podcast. And don't hesitate to get in touch with me at info@thestressfreedentist.com. And if you haven't already, please subscribe on your favorite platform and leave us a review. Until the next episode, I'm Dr. Eric Block, the Stress Free Dentist.